Hello, everyone. Thanks for joining us today for the next presentation in our series of webinar forums on managing stress. This is a joint production of the Department of Psychiatry, the University of Iowa Hospitals and Clinics COPE team, and the University of Iowa Employee Assistance Program. I'm your facilitator, Dr. Laura Fuller from the Department of Psychiatry. I have important information to share about this program. This webinar is provided for educational and informational purposes only and does not constitute providing medical advice or professional services. If you think you may have a medical emergency, call 911 or go to the nearest emergency room immediately. No provider-patient relationship is created by this webinar or its use. Neither the University of Iowa nor its employees nor any contributor to this webinar makes any representations or warranties, express or implied, with respect to the information provided herein or to its use. Okay, now let's get rolling. We're excited that you've joined us today. If you're watching the live stream version of this program, there will be time for a limited number of questions at the end of the presentation. Please use the chat function to submit questions. A recording of this webinar and further resources will be available at the Loop on the hospital website. Our presenters today are Dr. Alison Lynch and Kathleen Huisinga, both from the Department of Psychiatry. Dr. Lynch is a clinical professor in both psychiatry and family medicine and is the director of our department's addiction medicine program. Kathleen Huisinga is a licensed independent social worker, and she works as an addiction medicine counselor. The topic for today is substance use and recovery during COVID-19. During their presentation, we will learn about how the pandemic is impacting people's substance use and what help is available. Here to tell you more without further ado are Alison Lynch and Kathleen Huisinga. Thank you.
Thanks, Dr. Fuller.
Hi, everybody. Thank you, Dr. Fuller.
Yeah. So thanks, everyone, for your interest and for inviting us to come and talk about this topic today. It's definitely a topic that's of interest to both of us, and we're excited to share some information with everybody. We just wanted to start by acknowledging that the coronavirus pandemic has brought about unprecedented changes and stress for all of us. We're living during really challenging and stressful times. There's been so much rapid change that it's hard to keep up with. People are afraid about getting sick, contracting the coronavirus. Many people are facing possible or actual job loss and financial stress. Social distancing has led to many people feeling socially isolated. And I think we're all worried about the future. There's also concern that more people are going to be turning to substance use as they cope with all of these stresses related to the COVID pandemic.
Yeah, there's been reports that I've seen that have indicated that alcohol sales actually increased about 55% in March as the pandemic hit kind of across the country. So I guess like the question is, how do you know if your substance use is becoming a problem, right? So I guess the first thing that we would look at is what are the healthy or standard recommended amounts that the Iowa Department of Public Health would recommend. So those numbers would be about 3 drinks per day or in a sitting for women, and no more than 4 drinks per day in a sitting, or 14 drinks per week for men. And anyone over the 65, it would be no more than 3 drinks in a sitting, like per day in a sitting, or no more than 7 drinks in a week. And so, Dr. Lynch, would you mind kind of talking a little bit about what would be more of the rates in which we would consider it becoming a problem for someone?
Yeah, so we look at 2 different kinds of higher risk drinking, and one would be categorized as binge drinking, and that's where somebody during a 2-hour period would have, for women, it's 4 or more drinks in that 2-hour period, and for men, it's 5 or more drinks in a 2-hour period. So that's how we define binge drinking. And then heavy alcohol use is defined as binge drinking on 5 or more days in the past month. So we know that the more binge drinking and more heavy alcohol use leads to more medical problems, or the more risk of having medical problems. Yeah.
Oh yeah, what are some of the medical consequences, I guess, of those?
Yeah, so certainly one of the medical consequences that can happen when somebody has higher amounts of drinking would be alcohol dependence, but also just a lot of different body systems and health status can be affected by chronic alcohol use. So people can develop liver disease. Alcohol use can cause insomnia or memory loss. It certainly increases the risk of depression and anxiety. It can suppress our immune system, so we're less able to fight off infections. Alcohol use can cause pancreatitis. It can lead to vitamin and nutritional deficiencies. Can cause blood disorders like anemia or bleeding or blood clots. And it can also increase risk of cancer, particularly breast cancer or head and neck cancers. So I think one question that comes up a lot is, how do you know when your alcohol use is a problem?
Yeah. So generally speaking, alcohol use is one of the many types of substance use disorders out there. It is certainly actually the most common reason that Iowans seek treatment. But so, in terms of like alcohol use or substance use in general, some hints that it may be a problem is feeling kind of like the substance or alcohol is controlling you. You've lost control kind of over the amount that you're drinking or the amount that you're using. It may be interfering with your life. It may be causing problems socially with, friends and family. It may be causing problems with your job. You may be going to work with a hangover. Maybe you've called in sick a few times. You've been less productive at work. If you're getting physically ill when you're trying to stop. So like if you've not been drinking that day and you're, vomiting, or if you haven't used that day and you're feeling physically sick, that could certainly be a sign as well. And those are just a few of some of the signs that it may be a problem.
Yeah, and actually that's, to make an official diagnosis of a substance use disorder, we would use the DSM-5 criteria, and there's 11 different symptoms, and they basically all are defining those, what you just described, where people lose control of their use, they have trouble controlling their use, where their use is causing problems, and in spite of that, they have trouble stopping using, or if they have physical symptoms, if they try to stop using and have like withdrawal.
Yeah.
Okay, so I think we want to talk a little bit about treatment and recovery options and where people can turn for more information or help if they or someone they know has a substance use issue. Maybe we can talk a little bit about the different resources that are available, and also how the coronavirus pandemic has impacted those resources.
Yeah.
I know in my own clinic, we've seen an uptick in requests for treatment, especially at the beginning of the pandemic. We had a lot of people calling us saying that they felt like this was a good time for them to get into recovery.
Yeah. Yeah. And we've certainly noticed that here as well. I think that this has kind of forced people sometimes to kind of like slow down in some ways and take a look at this stuff. So as far as, treatment and recovery options go, there's a lot of different options out there, and there's different like levels of treatment, so to say, right? So one person may need, a higher level of treatment, and another person may not need that same level, depending on where their use is, and that kind of thing. But so the first one would be, detox. So that is, if you are experiencing those symptoms, that when you're stopping use, you're stopping drinking, and you're having physical symptoms of withdrawal of some kind, you may need detox to come off of those things. And there are detox beds in the community, places that kind of provide like a medically monitored detox area. The hospitals do that as well. And alcohol and benzodiazepines are generally the most they're the most considered important medically, be monitored and detoxed from. Did you want to talk anything more about detox, Alison?
Yeah. So I think of detox as just the process of moving from ongoing use of alcohol or a drug and moving into the process of not using it. And it's typically a pretty uncomfortable process, no matter what substance you were using before. But like you said, alcohol and benzodiazepines like alprazolam or Xanax or diazepam or Valium, if going through withdrawal from those substances can actually be more medically risky. And so we would recommend that somebody who is trying to go through detox from alcohol or a benzodiazepine, that they seek some medical assistance for that, just to make sure that they are not at high risk for adverse complications from that process. But either way, it tends to be an uncomfortable process. And so it is not a bad idea to at least talk with your doctor or your medical provider to get some guidance about how you could safely go through detox, or come to a clinic or go to an emergency room or go to a treatment program where you can get some guidance or some supervision during that process, and maybe some medical treatment if you need it. I think the other thing that's really important to say about detox is that it's really only the beginning of a recovery process. We know that if we help somebody go through a detox process and then don't provide them any other care, they are very high risk to start using the substance again. Detox is the beginning of recovery for people, but it is not treatment, and it doesn't really help people stop using in the long run. It just helps someone go through that process. So if somebody were to go through the detox process, then we would recommend, after they've completed that process, that they move into the next phase of their recovery and more treatment. And so you mentioned that there's some programs in the community, and maybe, Kathleen, can you just tell us a little bit more about some of the treatment programs that are out there?
Absolutely, yeah. So there's residential programs. So residential programs would be a place that you could go, you stay there and receive treatment while you're staying in the facility. And it's generally, between a few weeks to about a month or so, where you can stay and kind of remove yourself from, the outside stressors that may be there. So that's one of the options that's available. Most of the residential places in Iowa are still open and functioning and taking people. Some of them are functioning at a slightly smaller capacity than before COVID, but generally speaking, they are open and accepting clients. There are also outpatient groups. So at the hospital, we offer several different types of outpatient groups, anything from a few times a week to once a week. And a lot of places are offering online groups right now too. The university hospital is offering online groups, weekly online groups, multiple times a week online groups. And I believe a few agencies in the community are offering those as well. And then there are also, in addition to that, there's medications for addiction treatment. And would you mind maybe talking a little bit about that, Alison?
Yeah. So medications for addiction, we often refer to that as MAT, M-A-T, which is medications for addiction treatment. And that's generally office-based. So if somebody would go to a clinic and see their healthcare provider and get a prescription for a medication that they would take to treat their addiction. And it's often combined with counseling or groups. It can be, people can take medications when they're in a residential treatment program. Many people will take it longer than that, sort of on a long-term basis. And there's 3 different substance use disorders that have medications. Not all substance use disorders have a medication that treats them, but the ones that do are opioid use disorder, alcohol use disorder, and nicotine use disorder for smoking cessation. And there's a number of different medications for each of those conditions, and they're available with a prescription, and they work pretty well, and they can be an important part of somebody's recovery from substance use. One of the things that we've noticed since the COVID pandemic is they've made some changes to the regulations around outpatient care and also specifically outpatient treatment of substance use disorders. And so the access to medications for addiction have become much more accessible through telehealth. And we're doing a lot of telehealth right now in our clinic to provide ongoing care to people starting or continuing medications for addiction, even with during the period that we didn't have people coming into the clinic. And so we were able to do that over video.
Yeah.
And then another part of recovery for many people is mutual support groups.
Mm-hmm. Yeah. So, in addition to, a lot of these online, appointments that have kind of expanded and online groups, that kind of thing, a lot of support groups have moved to online as well. So, meetings that would normally happen like in the community in person are taking place online. And those include Alcoholics Anonymous meetings, Narcotics Anonymous meetings, Al-Anon family group meetings, and Smart Recovery meetings. And so AA and NA and Al-Anon family groups, they're all 12-step based and have, a component of, spirituality with them. Smart Recovery is a little bit different in that it's not 12-step based and not quite as focused on the spirituality aspect, but all of those groups have online meetings that are happening. I've had several clients say that, they can attend an AA meeting like every half hour if they, wanted to or needed to. So those communities have been really, building themselves up and surrounding each other and supporting each other through this. And that's been really great to see as well. And kind of, talking about going back to like the medications for addiction treatment, that kind of thing. Would you mind talking a little bit about harm reduction as well, and like abstinence only versus, kind of the harm reduction model in general?
Yeah. So I think harm reduction is just a really important concept in addiction. And it's really about meeting people where they're at and focusing more on reducing the risks and kind of negative health consequences associated with substance use. And recognizing that even if somebody is not ready to stop using substances completely, or they're not even willing to reduce their use, there are still often things that we can do to reduce the health risks associated with substance use. Probably one of the most well-known examples for that would be clean needles for people that are using IV drugs, and needle exchange programs so that people can have access to clean needles. That by itself doesn't necessarily change the frequency of IV drug use, but it can dramatically reduce the risk of infection transmission, and so reduce the chances that somebody gets hepatitis C or HIV from their drug use. And that's a huge thing. That's a wonderful thing that we can do for people. And so I think harm reduction is really important to kind of change how we look at helping people with substance use disorders. And really, another example of harm reduction would be dispensing naloxone to people who are at risk of a drug overdose, because then they could be resuscitated from that.
Commonly called Narcan, right?
Yeah, that's Narcan, right?
Yeah.
So I just think that having harm reduction be part of the conversation with helping people with addiction is really important. And it really affirms the value of each individual, no matter where they are on their path to recovery, and no matter how much they prioritize abstinence or how successful they are in completely stopping substance use, that they're still a human being that deserves help getting positive things for their health.
Absolutely.
And for many people, recovery isn't complete, does not to them mean complete abstinence. Many people who have a substance use disorder will acknowledge that they would like to be able to control their use and maybe use less, but aren't necessarily willing to make a commitment that they want to completely stop. But there are still things that they may be interested in doing to improve their health. So I'm glad you asked about that, because that's just a really important concept. I think one of the other questions that comes up a lot is when we know somebody that we care about and we're worried that they have a substance use issue, what are some tips for talking to them, approaching them maybe, or trying to get them to get help?
Yeah, absolutely. We get this question quite a bit, understandably so. I mean, so the conversation, the discussion, it's, going to be a difficult one no matter what. I think the main thing is to, come at it from a place of support and concern for them, coming at it from the point of how much you care about the person, and how kind of you're feeling about it, using I feel statements, rather than saying, you over and over again, and more of a place of support, less of a place of kind of assigning blame. That conversation, if it's the first one that they've ever had about it, can feel really intimidating to the person, with the alcohol use or drug use problem. And so no matter how you say it, it sometimes may not go the way that you were hoping. But just having that conversation is important. And then, it's stopping can be a really scary concept for an addict or for an alcoholic. And so, being ready to have a response that may not be the one that you were hoping for at the time, but to remember that maybe it's the starting point for them, and to get support for yourself as well. I think that that's an important thing to remember. And that's where, different support groups can come in. We'll have a slide at the end with some different resources as well. But that's where groups like Al-Anon family groups would come in. Crisis Center has some groups. There's a lot of online support groups for friends and family of people who have a substance use disorder of some kind.
Yeah. Okay, cool. So I think we have a slide just with a couple of key concepts that I wanted to just review. And then maybe we can see if Dr. Fuller has any questions for us. So the key concepts are, if there's just two things that people walk away from this webinar with, these would be the ones we want you to know about. That addiction is a treatable chronic medical disease. I think that often gets lost in the discussion, and people don't really realize that it's a treatable condition. It's not caused by bad choices, and it really is a medical condition that can be treated. And I really want to get that word out there because I feel like that instills some hope for people. And then the other key concept is just about harm reduction, and that often trying to find a way to meet people where they're at and work on maybe one step towards a healthier life or healthier behaviors or healthier medical issues is a positive step to take, and not focus so much on abstinence, but more focus on what is some common ground and some treatment goals that we can work on together to improve somebody's health. So maybe we can see if Dr. Fuller has any questions, and like you mentioned, we also do have another slide with a bunch of resources that will be available on the website afterwards that has some links to some websites and some smartphone apps and some online support groups and some hotlines that you can call in crisis.
Yeah.
All right. Thank you so much. That was a lot of great information about a topic that I've been hearing a lot about, and I think we may not necessarily be hearing as much as there is actually going on about. A couple questions for you both. First of all, does insurance pay for treatment for substance use disorder?
Yeah, so it does. Some insurances do. Most will cover it. There's a lot of different, kind of rules and criteria that they look at. But generally speaking, if a substance use counselor meets with you, evaluates you, and says that they feel like you'd benefit from treatment of some kind, insurance will generally speaking cover that. And sometimes figuring out who's in your network of providers, if you have like private health insurance, if you have state health insurance, you may be limited in different options as well. But your insurance company, if you call them, should be able to kind of give you who's in network and who you could go to also.
Right.
Yeah, and I'll just add that insurance generally pays for medications for addiction as well. And there are some federal rules that now require health insurances to cover mental health and substance use treatment, as well as they cover physical health conditions. So that's been helpful. I think more people now have coverage for substance use treatment than in the past.
That's great. Thank you. I was also wanting to ask about when someone is using and maybe heavily using or abusing more than one substance, like, are treatment programs equipped to take care of that kind of issue?
Absolutely. I think it mainly depends on, and Alison too, chime in if, but the severity of the use, right? So kind of, how it's affecting the person's life, what's going on. Most residential treatment programs, and even outpatient programs, frankly, would take somebody with a substance use disorder addressing more than one. So they call that like polysubstance use. But that's not uncommon. It's actually, I think, more common maybe sometimes to have more than one that we see.
Yeah, and that's a great question because a lot of the both facilitators and it kind of factors that maintain a substance use disorder will kind of apply to all of the substances that somebody is using. Many people will identify that prior trauma or depression or anxiety are part of why they are prone to using substances, and so, that will maybe drive their alcohol use as well as another drug use. One of the things that I've noticed that is just I find so satisfying in the work that we get to do is as I take care of a patient and I meet them and they want to start working on one of the substances that they use, and they often say, "No, I don't want to deal with the alcohol. I don't want to deal with the smoking. I don't want to deal with everything. That's too much. I just want to do one thing at a time." And I at first I used to find that a little bit like I thought, well, why not just get really healthy and deal with all of the substances? But what I found over time is that the experience of being successful in addressing one substance use issue is very empowering to people. And so often people come back and say, okay, now I want to quit smoking, or I've cut back on my drinking now. And because it gives them a sense of that they can do this, and that this has some positive benefits for them, and it just sort of reinforces their sense of self-confidence about being able to tackle an addiction. So I think definitely multiple substance use is very common, but it does not mean that people can't be helped.
Absolutely.
Thank you. One more question, and this is about can mental health issues and substance use issues affect each other? Does it ever make sense to treat the mental health piece of things before the substance use piece of things?
Yeah, that's a great question too. So some programs address both at the same time. Those are called dual diagnosis programs. Our programs here at the hospital, generally speaking, are considered dual diagnosis programs. So we look at both the mental health as well as substance use. And there are some residential places that also consider themselves dual diagnosis. In general, in response to the question, so I think it's hard to tell a lot of times, is it the chicken or the egg, so to say? And generally speaking, if somebody's in treatment with us, we ask them to try to, maintain abstinence while in group, and then kind of trying to get an idea for a baseline. How are you feeling with a little bit of sobriety? What's going on with your mental health now at this point? Trying to kind of get rid of a little bit of some of those other factors that might be playing a part and see what happens. Alison, what do you have to say about that?
Oh, I would agree with what you're saying. And also, it can be really hard to know what came first, but it's very common that people's mental health is sort of tied up in their substance use. And whether they're anxious because they have a substance use disorder or they're using substances to deal with anxiety, sometimes it doesn't really matter. I think in the end, we have to try to address both. And I think people are more likely to be successful both in getting their mental health symptoms under control and getting into recovery if both pieces are addressed.
Yeah.
All right. Well, thank you so much. That's all the questions that we have for today. I want to tell you how much we appreciate you sharing practical steps that we can all take to respond to the impact of the coronavirus. A recording of today's live stream, as well as links to additional resources related to this topic, will be included on the loop later today. Next time, we will be doing a recorded rather than live streaming version of these webinars, and it will be me talking about reintegration. So we'll see you next time. Thank you.
Thank you.
Thanks.